Welcome everyone to the Santa Barbara Response Network Compassion Center. These compassion centers were developed at the beginning of COVID to interact with our community about the issues that are going on, mental health and safety issues, and to offer a platform for our community members and various experts in education and mental health to dialogue with us and share their expertise on how we can, as a community, help each other. So it is my honor and pleasure to have my friend Liliana Encinas on. And Liliana has been involved with the Santa Barbara Response Network since its inception. So we've worked together in actually creating the network way back 12 years ago. And now she's a public education specialist, and she works with the Santa Barbara Fire Department, and she is the bilingual education coordinator for the Santa Barbara Fire Department and the national program director for LISTOS. And LISTOS is a grassroots disaster preparedness program, much like SBRN for mental health, they do for disaster preparedness. And I've been working with Liliana because she's also on Radio Branco every day, right, Liliana? To
Yes.
Share and answer questions in our Spanish-speaking community about the issues that are coming up surrounding COVID. So I wanted to have her on because we're all reading the numbers, we're all seeing the increases, particularly in North County. And I thought it would be a really good opportunity to have someone like Liliana here who can speak English and Spanish, and we're going to record this and share this widely in our community, to just have a conversation about what is going on, what is she seeing, what's she hearing, and also what we can all do to support the safety of our community, and particularly our Latino and Spanish-speaking brothers and sisters in this community. So welcome.
Thank you, Gina. Well, thank you for that introduction. I'm very happy to be here. I'm very happy to be part of any program or project that you put on. We go back a long way working together. And I've been fortunate to be in this place where I can educate and inform our community when it comes to disasters, emergency preparedness, fire safety. But in this moment, it's the pandemic and how we've had to be flexible and adaptable to this new norm. And so it's been challenging, and it's not an easy task. To be a crisis communicator is a big responsibility. And so it can be challenging at times, but it's also very rewarding in other times. And so I'm just happy to be here.
Well, I'm so glad. And please feel like Liliana is completely bilingual and will speak in English and Spanish because she's our interpreter also. But feel free, Liliana, at any time to speak.
Voy a tomarme este tiempo para como hacer un resumen de lo que hemos hablado hasta ahorita, ¿no? Y Gina me invitó a ser parte de este centro de compasión que hace el Santa Barbara Response Network. Y Gina y yo tenemos ya casi más de 12 años trabajando juntas. Yo fui involucrada en todo lo que fue la creación del Santa Barbara Response Network cuando inició, y hemos seguido trabajando juntas. Entonces le agradezco que me haya invitado, y Gina comparte sus pensamientos acerca del impacto ahorita del COVID-19 con nuestra comunidad hispanohablante y con nuestra comunidad en general, ¿no? O sea, ya que estamos viendo los números incrementar, que estamos viendo todo este impacto a nivel comunitario, ¿qué podemos hacer, no? Es lo que Gina nos quería decir. Y pues yo mi respuesta es que yo estoy muy contenta de estar aquí, tengo la dicha y la fortuna de ser una educadora de información, una proveedora de información en tiempos de crisis. Y al ser este rol o tomar este papel, viene con mucha responsabilidad, ¿no? Traer información y educación de una manera correcta, de una manera relevante y de una manera que no sea abrumadora. Entonces, pues muy contenta de estar aquí ahorita con Gina.
Eu entendo espanhol, não hablo muito bem, mas entendo tudo. Eu sou portuguesa. Se posso falar português, entendo. Mas when I lived in Mexico, vivi em México, eu falava, meu espanhol era como português. E eu, que língua está falando? Ah, é portuguesa! So, eu entendo, mas não hablo muito bem. So, gracias, Liliana, por estar aqui. My English is a little better. My Portuguese is pretty good, so we could do it in Portuguese, but you know, I don't know.
But then I would fail miserably.
I know, but our Latino, they understand. They entiendo um pouco de português. So my primeira pergunta, my first question is, from all of the questions, conversations, what do you see as some of the factors that are leading to the increase? I mean, you're speaking from personal and hearsay, to the numbers being so high in our Santa Maria community as opposed to here. What do you think is contributing to that?
Well, there's many factors that play a role here, Gina, and it's actually impacting our entire community. I mean, the numbers are very high in the northern area, but we've seen a duplication in numbers in the city of Santa Barbara, right? They're smaller numbers, but it still is a tremendous increase. However, I do see the impact being more in North County because of the fields of work that are in that specific area. For example, there's a lot of fields. It's a bigger city, right, than the central, and the next biggest city is Santa Barbara. There's more resources in the south coast area than there are in the north, and that's something we've always known. That you know, everybody's making an effort, organizations, community-based organizations, to have representation in the North County, and that's been a push ever since I came along in the disaster preparedness world. And I'm speaking on behalf of the disaster preparedness world, which is what the world that I live in. And so I do know that it could be the lack of resources, it could be the information that is being public out there and accessible. Sometimes we all see things from our prism. We see them from our own lens, and we don't understand how each individual, each family is a different culture. Everybody has a unique way of operating, and we cannot expect a cookie cutter, for an example, right, of a message to work for everyone. So we have to be diverse. We have to be inclusive when we talk about this message, whatever the message might be. So I think messaging, I think you know, the different workplaces, I think there's many factors that play to you know, a role in these increase in numbers. And of course, if for those of our viewers that have traveled to another country that do not speak the language, when you're in a crisis situation, it's difficult to comprehend what's happening, you know, knowing what's going on with the information you have. And now imagine, you know, getting to do all of that, but in a language that is not your native language, and with asking you to change the way your culture operates, the way that you have interacted all your life. You don't know anything else, right? And so here they are, you know, do not visit your elders, do not hug, do not do this, do not do that. And so it is for safety, but it takes time to process it. It takes time. And so unfortunately with COVID, Gina, we haven't had the time that's precisely what has been so wrong during this pandemic, that
Yeah.
every day something new comes up, every day something's changing. We have to keep adapting to the ever-changing situation because it's so new. This coronavirus is so new. There's very little comparison of studies of it's so new. So imagine for our community having something so new, so soon, so fast, so changing, everything at the same time. And now imagine that in a language foreign to your native language. And so it's challenging. It's challenging. I'm going to switch over to Spanish.
Your Spanish,
With
yes.
your first
Please.
question.
Please.
La pregunta que me hacía Gina a mí, me decía, ¿por qué crees tú o qué factores son los que toman un rol en el incremento o en el número alto de casos reportados en el norte del condado? ¿Por qué es que estamos viendo esto? Y mi respuesta era cómo hay varios factores, sí, que forman parte de estos números. En todas las regiones de aquí del condado de Santa Bárbara se ha visto un incremento, ¿verdad? Aunque sean números bajos, se han incrementado. Pero lo que sí podemos ver es que en el norte del condado los números continúan siendo altos por múltiples factores, y lo que se me viene a mí a la mente es la falta a veces de recursos. Siempre hemos mencionado cómo hace falta más representación de organizaciones en el norte. A lo mejor el mensaje que se está dando no siempre es relevante, no siempre es consistente, ¿verdad? Entonces es difícil tratar de digerir todo este mensaje cuando sigue cambiando, ¿no? La situación, los trabajos no son los mismos en el norte del condado como son en el sur, ¿sí? La habilidad tal vez de trabajar en casa en una oficina o tener que trabajar en el campo o tener que trabajar en otras áreas, ¿verdad? No permiten que a lo mejor uno pueda poner en práctica ese distanciamiento físico o social. Entonces son muchos factores los que yo pienso que juegan un rol, pero yo pienso que uno de los factores más importantes es tanto cambio, tan rápido, tan distinto, tan nuevo y abrumador todo al mismo tiempo, ¿sí? Lo que hemos visto con el coronavirus es que ha sido algo en un constante cambio, ¿sí? Y algo totalmente abrumador. Entonces, eso es lo que yo pienso que juega un rol muy importante en todo esto, ¿no? Y el que no es, a veces el mensaje no es en nuestro idioma, y si lo es, no tiene esa relevancia para nosotros. Entonces, esos son algunos factores que yo pienso que tienen que ver, ¿verdad? Con los números altos.
Gracias, Liliana. That makes it's very clear, muy claro, sí. And what would you impart, what would you like to say to our community as far as safety? What can they do? What can we all do to keep our community safe? Or what would you recommend?
Well, I would like to ask our community to be flexible, to be adaptable, and to be cooperative is the words that come to mind. It's hard, and as I mentioned, because of this, the situation that keeps changing, the messaging that's sometimes confusing, sometimes, it's contradicting, right? It's challenging. It's challenging, and I understand that, but we have to be flexible because of how new all of this is, right? And we have to be adaptable because as a community, if we are not able to adapt to these changing situations, if we we can't set the example, one, for the younger generations, and it just brings emotions that we have no control over. And the third one is being cooperative with the health professionals, with the messaging that is given to us by the experts. I believe me, Gina, I know that everybody's up to here with COVID. I know it. I feel it. and seeing how there's now closures in different industries, seeing how there's numbers that are doubling, seeing how, you know, hospital capacity is increasing, you know, the lack of capacity is increasing. Seeing all of this just brings us these emotions of, you know, just these feelings of, oh, I don't want to do this anymore. I'm just done. You know, I heard a comment the other day, you know, I'd just rather get the virus and get over with it. But you know what? That's not even a thing, because we don't even know if you get the virus, if you have immunity to it. We don't have the studies or the data behind that. So that's not even an option, you know, and we have seen the consequences or the aftermath of somebody that's been COVID positive, that they don't recover fully, right? They still have, you know, left some, you know, either through, you know, they have respiratory problems, they have neurological problems. We don't know. And so that's why it's so important that we cooperate and we listen, we stay informed, and we try to do what we're told. For example, the face coverings, you know, the social distance, the physical distance, the hand washing, those are all safety matters that are going to help us, right, to reduce that's those sentiments of stress, of anxiety.
Exactly. So just those basic safety measures, but understanding that this is such a radical shift from how we live, but yet we need to support, you know, those measures, each of us. I hate wearing a mask. You know, I hate being socially distant. I mean, we're all together in hating this. That's one thing we share, but you know, how can we all support each other to keep each other safe? So I'll let you share what you just said in Spanish, but
sure.
That's well said.
Me preguntaba Gina, ¿qué es el mensaje que yo quiero darle a la comunidad en este momento durante esto que está pasando, ¿no? O sea, ¿qué les quisieras tú decir? Y lo que yo le decía son 3 cosas muy sencillas, ¿no? El ser flexibles, ser adaptables y ser cooperativos. Es lo que necesitamos como comunidad para sobrellevar este momento difícil, ¿no? Que es la pandemia. Uno, siendo flexibles a la situación cambiante. Este es un virus muy nuevo. Hasta la misma ciencia está aprendiendo junto con el virus, ¿verdad? Adaptarnos a cómo vamos cambiando, siendo flexibles, ¿sí? Cuando hay restricciones, cuando no. Y ser cooperativos con los funcionarios de salud, con los líderes que nos están dando estas herramientas como cómo protegernos con un cubreboca, lavándonos las manos, practicando el distanciamiento físico, el distanciamiento social, ¿no? Esto es lo que tenemos que hacer como comunidad, poder cooperar, porque así estamos dando nosotros nuestro granito de arena, ¿no?
Yeah. Sí. And I don't know if are you there, Liliana? We may have had.
I'm right here. Can you see me?
Yeah, I think it just froze for a moment.
Oh, I'm sorry.
No, that's all right. May I ask you one more thing?
Sure.
Do you think that we should be more strict in our enforcement of these guidelines? Do you think that would be effective? We were having some dialogue about that earlier. Should we be fining people? Should we be telling them like we have to do this? How can we express the urgency of this situation? And I'm not a firm believer in like force but would that be effective? What do you think as an educational
that's a great question, Gina.
We should be more.
That's a great question. And it's come up in so many dialogues just in the past 2 weeks because of the increase in the numbers. And what I keep telling people is, if you continue doing what you've done and expect the same results, it's not gonna, expect different results, continuing doing what you have done, it's not gonna happen. You're gonna have the same results because you're not changing whatever it is that's not working. And so I'm a firm believer, but because of the agency I represent, which is prevention and safety. And so I'm a firm believer of, if having consequence to situations. Unfortunately, the mask wearing has become so politicized now that it's just heartbreaking to see how people take such a strong stance on not wearing it or wearing it. And it really isn't about that. It's about protecting each other, right? And respecting each other by choosing to protect yourself and protect others. And so I think there should, personally, Gina, I do, because I think that we're at a point where it shouldn't be an option to be protecting yourself and others. It should be something that we do because we've seen what has happened throughout these months. We have seen what happens when we do not protect ourselves. We've seen an increase when we did the reopenings, when we had mass gatherings, and now the increase in the numbers, and now there's this whole dialogue on the school district level of what's going to happen with our education, and it's becoming politicized again, Gina. It shouldn't be, because behind all of this is safety. That's the main goal. It's safety. It's saving lives. And I heard a comment today from one of the DLAC leaders, which DLAC are the parent group in the Unified School District that are the representatives in Spanish language of these these parents in the district. And she said something to me that just stayed with me all day. And she said, why can't people see that instead of creating memories during the school year of your classmates and of your field trips and of whatever, right? She was being metaphorically speaking. She said, you're going to be remembering perhaps those students or family members of those students that lost their lives during that school year. And so when she said that to me, it stayed with me all day, Gina, because in her eyes, in the way she sees the world right now, she can see that as something happening, right? And again, we all see things through a different prism. We all see things through our own eyes, through our own experiences. But because we want to be respectful of others and of the safety, the general safety of our community, we have to think beside ourselves. We have to think as a community. What is the best thing we can do as a community? And like our slogan says, safely, stronger together, safely apart is what it comes down to. So that's how I feel. Absolutely. I do feel that people should not have an option, the option to not protect one another. I think that should just be what it is, right? And I don't know if fining or something very specific like that would make a difference, but I do believe that something has to change for us to have a different result, something. And I don't know exactly what the formula might be, Gina, but I do think that something has to change.
Yeah. Do you want to share that in Spanish and then we'll wrap it up, Liliana? I want to see your little ones there in the background.
I'm reconvening the thoughts so I don't miss anything, Gina. This is the challenging part. Bueno, Gina me preguntaba, me decía, ¿tú piensas que es una buena opción el que haya consecuencias, verdad? Tal vez como un ejemplo, multas a las personas que no están siguiendo o cumpliendo con estas regulaciones o estas medidas de seguridad. Y mi respuesta fue lo que yo pienso es que si continuamos haciendo lo que hemos estado haciendo, esperando un resultado distinto, no lo vamos a tener, ¿sí? Tenemos que cambiar algo de lo que hemos estado haciendo para poder obtener un resultado distinto, ¿sí? Entonces, no sé si tal vez multando a la gente o los ejemplos que Gina mencionaba sean los mejores, pero lo que sí sé es que ahorita es el momento de dejar de pensar en uno solo, sino de pensar a nivel comunitario, pensar en cómo protejo y respeto a mi prójimo, ¿sí? El utilizar la máscara se ha vuelto en algo tan político que no debe ser, ¿verdad? Así como igual la educación de los niños no debe de ser algo político, no lo es algo de seguridad. Y precisamente porque yo vengo de una organización que trata con prevención, con seguridad de incendios, de preparación de emergencias, yo creo firmemente en que las personas deben de siempre pensar en la seguridad, ¿no? Y ahorita estamos en medio de una pandemia, ¿no? O sea, no es cualquier cosa. Le mencionaba un comentario que me hizo y de verdad le agradezco. Ahora tuvimos a unos padres del comité de DILAC, el comité para los padres que no son de habla inglés. Los estudiantes forman un comité a nivel del distrito y me hizo un comentario que se me quedó todo el día y me dijo, en lugar de estar pensando ahorita en cómo vamos a crear memorias con el anuario de la escuela, con que los niños se vean con sus amiguitos, los recreos o experiencias en la escuela, vamos a crear memorias de a lo mejor un ser querido, un familiar de esos estudiantes que perdió su vida debido a que fue más expuesto al virus. Y cuando me dijo eso, todo el día lo he estado pensando y digo yo, pues es verdad, ¿verdad? En el lente de ella, en la manera en que ella ve las cosas, todos la vemos de una forma distinta, pero esa es una realidad, ¿no? Entonces, tenemos que encontrar un lugar medio en donde nos respetamos mutuamente y nos respetamos en cuanto a todo sentido, ¿no? Si el respeto ahorita significa yo traer un cubreboca, yo guardar distanciamiento físico, porque puedo yo contagiar a una persona o contagiarme y luego contagiar a alguien más, pues ¿por qué no lo voy a hacer? Entonces, yo de verdad sí creo que tenemos que cambiar algo. No sé qué, pero algo tiene que cambiar para poder obtener un resultado distinto a lo que hemos visto, ¿sí? Cuando comenzó la reapertura y comenzaron todas esas modificaciones, ¿no?
Sí. Thank you, Liliana. It's been a long day for all of us. Every day. Todos los días.
Todos
Mucho
los días.
trabajo. But
Yes, Gina.
I want to respect your family time and respect your time. I just want to ask if you have any closing comments before we end. Anything you want to share with our community, and then we will close so you can have some dinner and some time with your family.
Thank you, Gina. Well, I think that for closing comments, I want to thank the community really, because it's been such an impact at so many different levels. And I think that, 4 months into it, 5 months into this, it takes a toll on you. And we have to recognize that, right? Recognize those feelings, recognize that frustration, recognize it, but we can't carry the responsibility of everyone, Gina. We can't. And I think some of us are drained because we carry that responsibility. And we feel like we have to make that difference. We feel like, it's too much on us. And so, what I want to say to you is worry about what is in your control, whatever you can control. So you can control not going out and exposing yourself. You can control choosing to wear a mask, choosing to do physical and social distancing. You can choose to wash your hands often, and therefore educate your family, your loved ones on that as well, and inform them that you can do what everybody else does. You can't, Gina. And so that is what I want to leave this with right now, because I hear it all day, every day, since the start of the morning. It's conversations after conversations, and we can't control anything. So I really want for people to keep those three words in mind: adaptability, flexibility, and cooperativeness. And if we are able to do that, we will have respect, because it's something that's going to come naturally, and we are going to have safety and be able to protect ourselves in all ways, right? Protect our emotions, protect our general well-being, and protect our physical health as well. And so I think that's the message that I would like to give everyone.
Thank you. I don't know if you want to share that in Spanish, but it was beautiful. And
pues,
then we'll end.
Me pregunta Gina que si tengo algún comentario para cerrar lo que es el Centro de Compasión. Y mi comentario es el siguiente. Yo le quiero pedir a la comunidad que por favor tenga esas tres palabras que les dije en mente, que sean flexibles, que sean adaptables y que sean cooperativos, ¿sí? Y quiero yo decirles que no carguen el peso de todo. No pueden ustedes tomar la responsabilidad de todo lo que ocurre a nuestro alrededor. No se puede. Y muchos de nosotros cargamos ese peso y cargamos la responsabilidad que le pertenece a alguien más. Entonces, no lo hagan, porque eso pesa con el tiempo. Entonces, preocúpense de lo que ustedes pueden controlar, de lo que ustedes pueden hacer un cambio, ¿no? Que viene siendo: no se expongan, no salgan para que no se expongan al virus. Usen un cubreboca, una cobertura facial, si ustedes quieren estar protegidos y proteger a alguien más. Practiquen el distanciamiento físico, el distanciamiento social. ¿Sí? Si ustedes hacen eso, ustedes van a cooperar y de esa forma van a ser respetuosos de alguien más y van a poder estar protegidos y proteger de los demás. Entonces, ese es el mensaje con el que yo los quiero dejar el día de hoy.
Thank you, Liliana. Muchas gracias for your service and dedication. And I truly appreciate everything that, not just what you're doing, but also the heart that you bring into everything, and you're caring for our community, and it's deeply appreciated. I just want to tell people, if they need, we're all struggling also emotionally and psychologically. Call the Santa Barbara Response Network. We have a call line, and we will help you if you're struggling with any issues in relation to COVID. And our number, and we'll put it on the Facebook, 805-699-5608. That's 699-5608. So please feel free to call us, and we will record this and share it, so that everyone can get an opportunity to hear the messages and the sentiment that we shared tonight. So thank you, Liliana.
Thank you so much, Gina. And I just, to answer one question that you asked me in the beginning, and I was waiting as I spoke and kind of diluted and really, digested this message. And you asked, what can we do to support the communities that are being impacted? And my answer is, support them the same way you would support your family. Support them the same way that you would support a loved one, which is, if you see, that the messaging is not being consistent, if you see that, whatever, the same way you would protect your loved ones is how you're going to protect, you know, our non-English speakers, our vulnerable populations, our seniors, everybody that's being highly impacted. So that's the answer to that question you made me in the beginning.
Yeah, thank you. Thank you, Liliana. So have a wonderful evening.
Thank you.
And
You
everyone,
too. Thank you.
and thank you for joining. And we'll see you next time on the Santa Barbara Response Network Compassion Center. Good night, Liliana. Enjoy your evening.
Good night, everyone.
Good night.